Welcome back to Big Ideas Little Table, and today we're going to tell you about, today I'm Peter.
Oh, and I'm Chris.
And today we're going to tell you about why you should be an ER nurse and why you shouldn't be an ER nurse.
There's just so much to unpack there.
So let's get started. Chris, do you want to give me one reason why you should be an ER nurse or one reason why you shouldn't be an ER nurse?
Okay. Well, I'll start with the should. You open with good news. We'll do like a compliment sandwich, so to speak.
The compliment sandwich. I like it.
Just PR.
Can I get mine with cheese, please?
Everything with cheese. For me personally, when you're dealing with patients, as you do as a nurse, it's
as a nurse you have patients? Whoa! I did not know this.
Not patients.
What the hell have I done?
as in a virtue, you get patients as in people you have to care for. You don't get patients. You lose patients. That just goes right out the window. Whatever you're doing in the ER, generally speaking, you're only dealing with this patient for a short period of time, which is fairly exclusive to the ER. I mean, you get it every now and then with the floor nurses, but when you're having a patient that's going to be there potentially for several days, it's like if you have a pain in the ass patient, you're stuck with them for the entirety of your shift. And within the ER, you generally speaking, you don't have that. So that I would consider that a pro.
I think it's a huge pro, actually. In fact, that's one of my favorite parts is that you get these patients that are, they really test your patients. They're just, interesting people. And the only thing that keeps me going is being like, all I need to do is get them discharged or get them up to the floor. Like one of these two things is going to happen over the next couple hours.
Treat them and street them.
And it's awesome. It's such a, thank you. They're gone.
When I worked on ambulances beforehand, I had a very similar thought process because it's like, even if this person is the most unpleasant, most obnoxious, most rude, most whatever it is, most intoxicated person that I'm dealing with, it's like 15 minutes. I just got to get through 15 minutes. You can scream at me. You can call me every word that you can imagine. It's just 15 minutes. I got to get you to the hospital.
Sounds like your wife during your honeymoon, actually.
Who told you I made it 15 minutes? Because that's a gross exaggeration. If I had a child for every time I was too fat, never mind.
Sorry, I had to.
Good.
15 minutes, nice.
Yeah. So I mean, it's a little longer than that in the ER, but still short term.
Yeah. So short term, definite pro. Mm-hmm. It's awesome. And then yes, you do have more patients come in, so you'll see more. You have to kind of re-up and do the same thing over again.
Mm-hmm.
But it's so nice just knowing if they're a jerk, you're only going to have that jerk for a little while. And even the times when I've had to hold patients and have them there for several hours, 8, 9, 10 hours, I'm just like, here, it's almost done. We're almost through this. You don't have to see them the next day. Floor nurses, mad respect, because you have to see these jerks day in, day out, maybe for a week, 2 weeks, sometimes months. It's crazy.
Well, and if I can go on a slight tangent about floor nurses, because every now and then when we're holding patients or whatever, we get the floor nurses that float down to the ER and they sit there and go, oh my gosh, I can't do what you guys do. You're in the ER. And
you're damn right. Now get upstairs. I'm just kidding.
You shut your mouth. You don't look at me when you talk to me. I feel a similar beat of respect towards them, because it's like, you do, it's a different skill set to be a floor nurse. I can't do what you do because, we're both nurses and technically we could both work in the same thing. But once you, get established in whatever you're doing, it's like, this is one set of skills and then there's a completely different set of skills. And so they like to go, oh my gosh, I can't do what you do. And I'd like to say it right back to them. I can't do what you do. So don't you're just as, you're just in a different sect and whatever. So it's respect to the floor nurses. Absolutely.
Respect. And very well put. That's so true, because everyone kind of has their own struggles, whether you're on the floor, whether you're in the ER, whether you're on the ambulance. Everyone has their poop to deal with, you know what I'm saying?
Yes.
And it's just different poop, Yeah. Sometimes it's watery, sometimes it's, no, I'm just kidding. So you did a pro. I will do a con. One con why you should not be an ER nurse, and I think it's the most obvious one, is the chaos.
Mm-hmm.
Sorry, let me try that again. It's the chaos.
Chaos.
I'm bringing my inner Batman. It is a chaos because it can be super stressful and all these things going on at once. And I think you have to be able to prioritize, number one, and just kind of put that stuff aside, not get flustered, and be like, okay, well, I'm going to do this. I'm going to do my priorities. I'm going to focus on what I can do and go from there. I've seen a lot of people just get really flustered and kind of stop, not know what to do, maybe do things that weren't the priority. So it can be really challenging. And I think that's one of the cons of being an ER nurse, is that sometimes you're like, what the F have I done?
Yeah. Yeah, and I mean you're absolutely right. Just trying to get the flow of things, and sometimes like people throw just a immense pile of poop at you. And
is it the watery or the?
I mean, it can be the literal. People can be like chimpanzees.
Actually,
it's terrifying.
I think that happened the other day, but save that story.
It's for another time. But I mean, with just a chaotic environment, it can just add a level of stress to what you got going on, and so learning to balance out emotions and stuff like that can take a toll on you as a person, and it's just be like, oh my gosh, like you gotta be able to let it all go when you get out of work and go home and understand that it is for the short term.
Yes, and going back to the pro. So really, the con is solved by the pro. Now, how do you let loose? How do you get rid of all this built up stress and anxiety?
Did I tell you that I have 4 kids?
Oh, yeah, sorry. The 15-minute man here, everybody.
It's not 15 minutes.
The 8-minute man, everybody.
No, one of my, and this is important. Whatever you choose to do as your means of relaxing, be it whatever, meditation, music, whatever. I for one love video games, because if you kill things that aren't real, it doesn't hurt anybody for real. We should put that on a T-shirt. Can we put that on a T-shirt?
That totally needs to be a T-shirt. That's good. I like video games too. I mean, I don't play them nearly as much anymore. I think my de-stressor is exercise. I just got to get it, like physically just get it, like sweat it out.
Sure.
You know? So if I've had a bad day, or if I'm just frustrated or stressed about something, I just got to run it out. Actually, I hate running, but I think that makes it even better. Like
when you hate yourself, when you're like, God,
I just double hate myself right now.
I need to hate this. No.
It's almost like I get so low. I'm like, well, it's only up from here. I had a bad day at work. I'm running. Like, what could be worse? I'm hungry on top of that.
If I get hit by a car right now, it doesn't even matter. Put me out of my misery.
Yeah, so I just got to like scrape the bottom, and I'm like, okay, I'm good for the rest of the day.
You're really fighting that dad bod. I'm so proud of you. Going back to the other one.
I'm fighting the dad bod. I told you. Trophy husband. That's going to be my new career.
You should get that tattooed on your killer biceps.
Trophy husband on the other side.
On your knuckles.
Just let me see if I have to do the count later.
TR.
That's hilarious. That is my dream though, trophy husband. So we'll get there eventually.
You already got the sexy profession, buddy.
Get the sexy profession. Now I just need the get rid of the dad bod or keep it. One of the
two. Whatever your path, lean into it. Lean into it.
All right, let's hear another pro for why you should be an ER nurse.
Another one that we fully enjoy in the ER is just having the doctors right next to you. And I mean, this is waxing a bit more medical for the non-medical people listening in, but when you're needing orders put in or whatever it is, we have a certain level of autonomy in it, and that does come with nursing in the ER and stuff like that we're allowed to put in certain orders based off of a presentation of a patient or whatever. But so if a patient's presenting a little weird, or if you just want to validation for what you're putting in, having the doctors right there, and the fact that we work with them so often that you'd be able to develop a rapport with a lot of them and communicate with them, and it's like, hey, I'm going to put this order in, is that okay? As opposed to like, what do I do? And so it's just like, it's nice to have them there, even if it's just for validation or whatever it is, that just having the doctors right next to you, as opposed to those poor floor nurses who have to like call, and if it's in the middle of the night, they got to wake them up, and it's like, oh my gosh.
I couldn't agree more. In fact, that's one of my least favorite things, is having to call the admitting doctors, because the patient may already be admitted, but they're still holding in the ER. Mm-hmm. I try and get everything I need before that moment, because they don't know the patient. They're like, it's the middle of the night. Oh no. I talk to the ER doctors for everything. I think they get annoyed. They're like, oh, this guy again. But I'd rather just have that, like you said, you can go over orders, you can go over, hey, I don't think this patient's looking too good, or this is my mindset, why are we doing this? It's just so nice to have right there. And some doctors are great at it, some are not. Yeah. I'm sure we can all think of a few.
Sure.
But love having the doctors there, definite pro.
Yeah. I don't think they get too annoyed just based off your beautiful physique that they have to. I mean, they're like, "Who is this Adonis of a man walking through?"
Well, I do show a little belly. I walk in, I'm like, tell you what, favor for a favor. Check this out.
Drink
now.
this in. You tall glass of water, you.
Let me get some Zofran, okay, Doc?
Whatever you want. So flustered now.
If I was going to use that, I wouldn't be using it for Zofran, let me tell you that.
Yeah.
It'd be for something, one of those, the hard hitters, one of the things that's hard to get.
What's that D one?
What's
the
that?
D one?
What's the one that starts with the D? It's the only one that works.
I'm allergic to everything else. Is that a perfect segue into one of the cons of unpleasant people? Look at that.
Give me knuckles on that one. Nice. Trophy husband, by the way. Perfect segue into my probably least favorite con, the unpleasant people.
Mm-hmm.
There's so many. I don't even know where to begin. I'm like, you ever have where you're like so hungry and you get a plate of food and you're like, I could start here or I could start here. What's going to be first? And you just like shove it in your mouth at the same time. Mm-hmm. That's how I feel about this topic because there are so many unpleasant people in the ER. Let's begin.
Tell me what you want to shove in your mouth.
Frequent flyers, family members,
mm-hmm.
prickly doctors, mm-hmm. bitchy nurses. Mm-hmm. There are so many unpleasant people in the ER. And I know some of these exist in other areas too, but I feel like the ER is so much more heightened because of that stress, because of the chaos. Everyone is just like, wow, I'm crazy. Mm-hmm. So I just want to tell people, just calm down. Just take a second. Like, yes, there's chaos, but it doesn't mean you have to be chaotic. Mm-hmm. Just calm down. So let's start with the frequent flyers because I think that's everyone's least favorite. What's a frequent flyer? For people that don't know.
There are individuals out there, and I know this is going to shock a lot of people, that have a tendency to abuse the emergency system.
No. I people would do that?
Stay with me. And unfortunately, without getting too far into another tangent of like healthcare and how some people are, based off of their insurance, incentivized to go to the ER versus going to urgent care versus going to their primary care physician. But the people realize that if they go to the ER, they are seen in a faster fashion and potentially have their problems addressed quicker than they would if they were going to like their primary care physician. And so we become the primary care physician.
So true. And I get it. That's to their credit. I understand because usually when they come in, they're like, well, I tried to call my primary doctor and they said I don't have an appointment until 3 months from now and I still have this problem and this and that. I understand. But sometimes, most of the time with those patients, I'm like, well, you see, the ER is for emergencies, like big things. Like you're not going to make it if you don't come in tonight.
It says it right there on the door.
Yeah. You know those like 3 signs that you passed?
Giant red letters. Yeah. Giant.
That means it's an emergency. And they're like, well, I've had this toe pain for 3 weeks and it's not going away. I'm like, yes, I empathize with you. I know it hurts. I know you feel helpless, but what people need to understand is they really have to go through the system because or else it's just going to keep, it's like a rotating door. They come to the ER. We want to send them to their primary. They come back to the ER. We got to send them back to their primary. Mm-hmm. Round and round they go. Now the frequent flyers, they can be those ones and they can be transients, vagrants.
The ones that breathe in the lobby like we talked about.
Exactly, yes. So we have these patients that constantly come in and it's not because they really have any issues except they need a warm place to stay.
Sure.
They maybe have some mental issues mm-hmm. and they abuse drugs, alcohol, stuff like this. And at first when you see them, which I think most people, 99% of nurses, 99% of the staff totally are down to help and they want to address these problems and they're prompt and all those things that healthcare should be.
Sure.
It's the 20th time that you've seen them in the week. That's when it starts to break a little bit. This 20th time you're like, Mr. Smith, again?
Drunk again.
And it's always the same issue. True. And they're always fine. Vital mm-hmm. signs are stable. They look great. Okay, well, they don't look great, but they look stable.
Can't kill a cockroach. Terrible. And so you get cynical.
You get so cynical. So, and that's one of the cons is that it really weighs on your patience and your sympathy and your empathy and all these things because after a while you're like, no, these people are just abusing the system mm-hmm. and they're not even nice.
No.
And I'm not saying you have to be nice to get good healthcare. I'm just saying
it helps.
It helps. Be courteous. Like these people are just, they come in and they're so rude mm-hmm. and they're just they want everything that they know they can't have.
Mm-hmm.
They don't want to follow instructions on proper care. They don't care for themselves. They have plenty of resources. They don't take the resources that we have. It's a very frustrating thing.
Yeah.
And they keep coming in.
Well, and like you said, like the first couple times you offer these things, homeless shelters, abuse, like support groups and things like that, and then it just gets completely disregarded. And it's like, okay, so I'm trying to help you and you're not receiving that help, but you continue to come in and expect me to fix whatever short-term problem is a result of the long-term problem that we tried to address and you ignored.
It's a rotating door, and it keeps happening, and they won't help themselves.
Mm-hmm.
And they come in, they always want the turkey sandwich. You know, it's just,
I've never eaten our turkey sandwiches. Are they that good?
I've never had one either, but that's what we need. We need a sign, you know, those 3 emergency signs right underneath, like out of turkey sandwiches.
Like a no vacancy, but for turkey sandwiches?
It has like a little light turns on
Oh,
and
sorry.
off.
We
just
ran out.
We just had the last one. I'm sorry. Mr. Smith took it. So you're going to have to hit on to the next town.
Keep it moving there. No room at the end.
It sounds terrible. I don't want to make it sound like we don't want to help people, but when you know that people clearly don't need help, that they're abusing the system, things have to change. So that's my problem with frequent flyers.
Or that they don't want help.
They don't want help, but they do. They come into the hospital, they ask for taxi vouchers, they ask for food, they don't want any medical.
They want the free stuff, not the actual help that we're trying to provide.
Yeah, it's like, I'm like, you don't want this free stuff. It's not worth it, man.
Are you kidding? Those free, jogger sweat t-shirts that we have from 2014, from the St. Patrick's Day fun run.
That's
I think we finally ran out of those.
They're all gone? Oh, man.
I think so.
Those are pretty cool.
I almost took one of those too with the turkey sandwich.
I was like this close, but then I remembered
Mr. Smith was probably going to come in later and he needed a turkey sandwich.
He needs that too. All right. Other unpleasant people that we deal with. Family.
Yeah.
The big one. Sakan in the ER.
I'm gonna be a good person right now and say that it can also be a pro. Okay.
Look at you. Why do you have to make me look bad? Is this good cop, bad cop today?
Yeah. Listen, we know where they are. Okay, never mind. The bright light, it threw me off. I'm dazed. No, because when you do have a patient who is altered or is acting strangely, and it might not be strange enough for us to notice that having the family, having that source of information, having that other person to advocate for them can be a pro. The con comes in when they don't necessarily, they think that any sort of unusual behavior is an emergency. And so then they're potentially upset with you because they're like, oh my God, their blood pressure, it's 150 over 90. And it's like, okay, yes, that is hypertension, but that's not an emergency. And so maybe just go see the primary care physician. Cause
you don't pull the code blue switch.
Get him in here.
Everybody in here fast.
I need it stat.
Doctor, we got a blood pressure 150 over. Did you say 90? It's 150 over 90. Whew. Cut the clothes. The clothes have to go.
Get them naked. Stat. That's why I became a nurse. There it is.
I agree with you. Family does have their part to play. And I like good family members. So let this be a lesson. If you're going in, which is funny because it's kind of like common courtesy. If you're going in anywhere else, why wouldn't you be courteous? If you're going to an office building, if you're going to a mall, if you're going someplace like that, you would never yell and scream and act privileged, right?
Sure.
But somehow they get in the hospital and all of a sudden they want everything. They want it now. Like I've had where we're literally coding a patient, someone's dying next door, and the family's like, he still hasn't gotten his sandwich.
Where's that turkey sandwich? Give me the goddamn turkey sandwich.
You're like covered in blood. Like
what?
And he obviously was so professional. I'm still like, I'm working on it, ma'am. It's just going to be another 5 minutes.
We will get there. Don't you worry.
Once I can get his 60 over 20 blood pressure stabilized, I will be right in.
Just trying to get pulses back. Once I got those, your sandwich is on the way.
Wait, what is that? Weak pulse? Okay, he's fine. Leave him.
Sandwich.
I need a sandwich stat.
Get it in here. Get it in here.
So did you want that warmed up, ma'am? You did. And a pillow. Okay.
Warm blanket too. The warm blankets. Everybody loves the warm blankets.
They do. And I get that one because it's cold.
Sure.
The pillow kind of gets me. The pillow and the turkey sandwich.
Yeah.
Let's talk about the turkey sandwich for a little bit since we keep coming back to that.
Mm-hmm.
Why do people just need to eat? Like they come in, right? And they're like, I haven't eaten since 2 a.m. But now all of a sudden they're like, I need to eat now or else you don't want to see me when I'm angry. I'm like, how did this happen? Like, you can't wait another couple hours? You obviously haven't eaten since 2. Come on. Like, you said you have abdominal pain. Give it a break. Maybe that's your problem.
I had a patient the other day, and I know alcoholism is a thing. It's a thing. It's a thing. People need to get help. But this patient came in and he said, yeah, I haven't eaten anything for 4 days. And then I get his alcohol level back and it's way above the legal limit. And I'm like, so it's not a matter of you couldn't make it to the food. It's a matter of what you chose to grab when reaching.
I always think about, the show Maury, when he does those paternity tests.
Mm-hmm.
I love getting the UDS back. You know why? Because of that. Or even like the alcohol levels. It's a little something like this. Well, Kim, because let's say you have the family there, right? And they're like, what's wrong with little Jimmy? What happened with little Jimmy? Kim, little Jimmy said he never used cocaine. We have the results here. That was a lie. He also said he didn't have anything to drink. I have the results right here. Kim, that also was a lie. And I love how like little Jimmy is still denying it. He's like, no, I swear, Ma, I swear. And I'm like, okay, like, I don't know. We could run the test again, but
it's fairly conclusive. I know I had another female patient once who had said, oh no, I don't do drugs. TalkScreen comes back with meth in the system. And she's like, well, my boyfriend did it and we had sex. I'm like, it's not a sexually transmitted disease. I don't understand.
Sexually transmitted overdose. It's a thing. It's a thing.
I don't know how to, there are no words.
I had a fentanyl overdose the other day. I swear I didn't do it. But I slept with someone and, it crosses that barrier.
She just laid it right into me. Oh my God.
It could have been a lot worse.
It's a good thing he pulled out.
Had I been on for more than 15 minutes, who knows what would have happened.
Dead. There's no coming back.
But anyway, family can be a big source of unpleasantness. Can also be a source of great help. So family, be the ones that help. Don't be the source. Don't be the sore for us, okay? Please.
Demanding turkey sandwiches.
Demanding, asking how long it's going to be. Come on, you're going to the ER. Don't ask how long it's going to be. This is another con. We didn't have this listed, but this is another con because people in the hospital on the floor, they probably do this, but maybe to a lesser extent. People in the ER, every 15 minutes, it's like, how much longer?
What are we doing? What's going on? Why isn't there something happening?
Once again, you come in covered in blood. 10 more minutes and I'll see what I can do. I'm just waiting. The doctor's right next door. As soon as he comes out, we'll see if we can get you walking home. This guy might not go, but we'll see about you.
He's probably going to die, but we'll get you that taxi voucher. No problem. Can we end on a positive note?
Yes.
Because we got a compliment sandwich, like we said.
Compliment sandwich. Let's do it.
I'm going to say that one of the great pros of working in the ER, and this comes with the ICU as well, is you do get a level of respect as just because of what we do see and what we do get we do get exposed to, and it's a broad range of different types of things, and so other nurses have a tendency to realize that and you get a level of like, oh, I've worked in the ER for 2 years. It's like, oh, well, so you must know what you're doing. And like I said, I feel like it goes the same way with ICU, but just because they're seeing such specific stuff and working so hard to bring people back from the brink, so to speak. That's true. There is a level of respect that the ER has that maybe other floors or other areas don't. And one of the things that's a pro, kind of like you said, is that you see a lot of everything. So you know a little bit of a lot of things. Mm-hmm. So when I could see an OB patient and kind of be like, okay, I know a little bit about that. I could see a peds patient. Okay, I know a little bit about that. I could see a stab wound. Okay, I know a little bit about that. Mm-hmm. So it's kind of nice that whatever comes in, you kind of have a background. You kind of have a little bit of, not warning, but knowledge on how to treat this. Some of the floors get so specialized. Mm-hmm. OB, neuro, yes, cardio, exactly. Stuff like that they specialize so much in that if you were to hand them something else, it's kind of like, or if something else happens with the patient, it's like, whoa, yeah. I'm not ready for this. So a big pro is that you get to see a lot, you get to learn a lot. So I would always recommend it as a base, ER, and then you can kind of branch out if you want to specialize in neuro, cardio, OB. Botox, whatever. Exactly. You can go to the ER, get all the experience, kind of see a wide variety of things, and then branch off from there. Get those crow's feet taken care of. Would you ever do it? There's a lot of talk. For me?
No. Would you ever be like what do they call it, an aesthetic nurse or something like that?
I could probably do it. Although I don't know if it really, because not to be sexist, but I feel it's primarily women. I don't know if they want me. It kind of goes back to my OB stories where I was crawling around in the OB rooms.
You never know. You got good skin. You could sell it. Like how I got this cream right here, or this. I don't even know what it is. This injection.
Yeah. Listen, you're the trophy husband. We already established that multiple times over.
I'm just pretending like I don't do it. I'm like, what is that again?
So,
like they put it here, and then maybe some here and here, and then
I don't know.
Recovery is 2 to 3 days.
Ice it if you need to.
Liquid diet. I would never do it just because I don't like needles, which is kind of a funny thing. I have no problem poking someone with needles, but me personally, different story. Ugh, it gets me.
I might poke you. Sorry, kids.
That sounds like a scary movie right there.
Well, all right. I want to say one thing before we end today that I learned that helps deal with a lot of the stress and stuff that I had an instructor tell me when I was going through EMT school back
way back.
He said, always remember that it's not your emergency. And it seems silly, but it just gives you that level of disconnect to help you keep calm in a chaotic situation. Or if somebody's yelling at you, you can step back and say, it's not my emergency. I'm only here to help.
That's solid. No, I really like it because I think that is the key. We spend so much of the day being in our heads like, oh, this patient again or that again. Mm-hmm. You just have to be like, okay, well, this is my job. Getting paid to do it. They're obviously going through a really bad time.
Sure.
Let me get them that pillow as soon as I can. I think communication is a big key. So kind of going along with your point, if you just communicate to them like, look, let me just tell you, this is what we can do. We're doing the best we can. Mm-hmm. This is kind of how it's going to go. And kind of trying to get on their level and kind of understand where they're coming from. I think that's a great point. I like it. That's another pro for working in an emergency department or in emergency situations is that you get to help these people in their worst time. Mm. So it's a very altruistic type of feeling.
Sure.
Because they're already stabilized when they get to the floor. It's a lot less urgent. Like, you got to do something, got to help him.
Floor nurses don't do anything.
We're going to go back to this one, huh?
Just kidding. Mad props to floor nurses. Absolutely.
So if you are thinking about being an ER nurse, hopefully these pros and cons will help you. Plenty of pros. There are also some cons. Just like anything, there are good things about jobs, bad things about jobs. And I think you should I would suggest it. Like I said before, I think everyone should have a base in the ER and then be able to branch out from there. What do you think?
Absolutely. Like you said, you get to see a whole lot of different stuff, a wide variety of things, and then you can kind of take from there and decide that you want to go a path like, oh, well, I really like cardio, I really like neuro, I really like whatever. And having that breadth of, oh, wow, yeah, I've seen some trauma, I've seen some of this. It's awesome.
And then one last thing, you'll notice I'm wearing a lab coat. I'm not a doctor. I am a nurse. This is one thing in nursing school that, did you have to do it too? Did you have to buy the lab coat?
I did not.
Maybe it's a California thing. They made us buy these lab coats, as you can tell. School of Nursing. This is legit. This is the second time I've worn it. One time when I was trying it on to buy it, and now it's such a waste of money. I don't know why. If you're in nursing school out there, please make us stop buying these.
But you look so dashing.
It does.
The trophy husband.
It does put the smolder in the nursing, right? I'm like, hello. Would you like that pillow?
How about a turkey
soft
sandwich?
Or hard? Was that too far? That's too far.
I'm into it.
But seriously, that's why I'm wearing it, because I'm getting use out of this. I had to pay for it, so making good use.
I fully support.
There are a lot of silly things you'll have to do as a nurse. Just understand why you're doing them, and that you can make someone's day a lot better.
Absolutely.
Thanks, guys.